Alrighty. Thank you all for joining us. We have Teressa and Rebecca here today. Teressa is a BCBA and Rebecca is a BCABA. They specialize in early intervention, autism, in-home services, and Teressa's been in the field for 10 years and Rebecca's been in the field for 5 years. And I'm going to turn the time over to them. They're going to go over picky eating today.
Thank you, Camille. Thank you so much for the great introduction. Rebecca and I created a training just to kind of go over picky eating for a lot of our families. This will cover a wide range of ages. There's going to be a lot of things that you want to consider as you're thinking about some of these strategies in terms of your child, their needs. So we're going to go through all of the considerations and then we'll go through some strategies with you guys. So we'll talk about what a picky eater is when it's an issue, thinking about some of those medical or biological considerations, other things you should consider in terms of the environment as you get ready to work on feeding with your child. Environment can kind of be a big factor. Some strategies, and then planning and generalization. So long-term, how do you keep up introducing your child to new foods? How do you keep reinforcing them wanting to be, a little bit more of an adventurous eater? So when we talk about picky eating, it's always interesting when we work with families because I ask families, would you classify him as a picky eater? And some families will say, well, he only eats chicken nuggets. He's not really a fan of some vegetables. And sometimes it's not too big of an issue. When I ask parents how selective their child can be and how picky they can be, I typically think it's an issue or concern when we have less than 15 foods that we frequently eat. So I typically have parents narrow down and tell me what those foods are. And then we kind of look at, well, what's within those issues? So do we have frequent food refusals? So that means they constantly refuse to eat food, or they have a limited repertoire, meaning they only eat carbs. They only eat crunchy foods. They're not eating any wet, textured foods. Sometimes we have kids with excessive intakes of a few foods. So because he only likes chicken nuggets, that's all he eats, but he eats a lot of chicken nuggets. He eats a lot of fries. And long term, we know that he's really not going to get any healthy benefits from those foods. So we want to make sure that we can expand his repertoire and get him to eat a little bit more. Then we also have selective intake of certain foods. Again, we have a lot of kids, especially because we work with children with autism. They eat a lot of carbs and they're really stuck on carbs, rices, breads, a lot of starches. Getting them to eat fruits and vegetables sometimes is a challenge. So we want to consider these things when we talk about a picky eater. Sometimes kids go through different things like growth spurts or just changes that result in some picky eating or some selective, oh, I don't want to try that. That's okay. But when we're talking about a picky eater, you want to think about how picky is my child. So when we talk about picky eating being a concern, we're looking for kids that, have either poor growth or failure to thrive. So this is hard because typically you go to your doctor and sometimes your doctor will say, well, he's within his percentile. He's still at the right height and the right weight. So that can be a challenge because you as a parent are like, no, I'm still struggling during mealtime. But from a medical standpoint, they won't consider your child to be an issue. There's other factors that we consider besides the poor growth or the failure to thrive. So again, obviously there's deficiencies or underweight. So they may have vitamin deficiencies, and that occurs because kids only eat specific foods. They're not getting the vitamins that they should be getting from certain foods, the nutrients that they should be getting from certain foods. Even in terms of kids who are eating only junk food, we have the overweight and obesity issue. So because they're only eating chips, snacks, those chicken nuggets, they're great, but they don't do much for us. It's causing that obesity piece, impacting their social functioning. So when we think about social being part of mealtime should be, we have a family meal, we sit down, we interact, we socialize. So that piece can affect their social skills. Even in a school setting, we've seen kids who won't sit during snack break and they won't sit at the table with the other kids. So we're limiting that opportunity for social. Daily living and family routine. So we have had families who say We just don't even go out to eat at restaurants. It is exhausting. I don't want to put him through that. And he just cries and he tantrums until we leave. He refuses to eat anything that that restaurant offers. So we're not going to waste our time. So in the long run, it's starting to affect daily living, even your home family routine, where he eats at different times. He eats different foods. He doesn't necessarily, sit and just tolerate at the table. He might be throwing foods. He might be crying, screaming. So now we're affecting our entire family. Then we have the response to foods will become extreme. So in some cases, we'll see kids gagging or even, throwing up at the sight of certain foods. Their response is almost to the point where you're like, okay, I get that you don't like it, but you should not scream your head off. You should not be this resistant to a food being on your plate. So when we look at these pieces, then we say, okay, yes, this eating is kind of a concern, and maybe it's something we should look at and target. When we look at research, the research on picky eating is pretty interesting. We have about 25% of typical developing kids that have feeding problems. So it's not just kids with special needs. There are a lot of kids who are just picky eaters. When we look at the special needs area, those kids, we have 80% of them that are showing a need in feeding, that are showing deficits in feeding or being selective in feeding. And then typically we're seeing that at around 18 months is when we start to see that kids are developing these picky eating habits. These, I don't want that, it's not going on my plate, I won't touch it, I won't smell it. That's usually happening around 18 months. So when you look at all the research and you compare it, you think about, well, what's happening around 18 months? We work with early intervention, and we know that right around 18 months, kids start to develop a voice and some kind of communication, and they start to understand that no means no. And so they start to get some control over what goes in and out of their mouth. So looking at that piece, we're also looking at them being able to tell us, I don't want it, and them having that control and having that autonomy. So it is very understandable that 18 months is when we're starting to have those pickiness or that picky eating start to come out. They did have some studies about, a lot of our kids with the high carbohydrate diets, they typically have some medical issues. So the constipation, because they're not really eating any other types of vitamins, nutrients, or fibers. A lot of the parent surveys showed that parents were often prepping other foods or only the preferred foods of kids. So we like to say that parents become short order cooks. You're prepping one meal for one child and another meal for another child, and maybe a different meal for yourself. And then also they noticed in the research that kids with autism typically like to have a preference of certain things. And it's sometimes things as simple as the way the food is presented. It's got to be these type of fries, the crinkle cut, and not straight fries. No curly fries. For us, we're thinking it's a potato, it's the same thing. For them, it's completely different. So presentation matters to those kids, and then even the utensils. So specific types of utensils. He wants the car's spoon and not an adult spoon. Things like that, they were noticing that those kids have preference towards. So when we look at a picky eater, when we get a kid in our program and mom says, oh, I really want to work on his eating, it's driving me nuts, we try to kind of rule some things out because we're BCBAs and a BCABA. And so we come at it from a behavioral standpoint. We can try to make things fun, we can make some adjustments, but if there's something medically wrong, you always want to get that solved first. You always want to get that looked at first. So one of the medical issues that comes along with feeding is gastrointestinal. So you'll have some kids who have issues with digesting certain types of food because they've had an issue digesting it. Just like us, if we ate something and it made our stomach hurt or we didn't feel good later, we're likely to not eat that food again. We have basic cause and effect reasoning. So for kids, that will happen. If they had an issue digesting it, they won't eat it again. Another thing to consider is kids with feeding problems typically have reflux, so they might be throwing it up. It doesn't go down all the way, it gets stuck. Diarrhea, constipation, again, because certain foods are not being processed the same way that our body's processing it. Allergies that we may not be seeing, heartburn, excessive gas. So if your child is a super picky eater, we always recommend just checking in with the pediatrician first. taking some information in on what they're eating, on what they're not eating. Some of those things can help you, but a gastrointestinal can, like a GI doctor, can basically look at how their body is processing food and if it's not happening. GI issues are very, very common in kids with special needs because they can't tell us that it hurts or that that didn't feel good when we ate that. So this is definitely something that we always tell parents, well, let's make sure there's nothing medically going on. The other piece is swallowing or chewing issues. So we do get a lot of kids who pocket food, who don't chew food. Parents are like, he doesn't really eat a lot of, like meat or really chewy textures. And when we look at that, we look at, well, why is that? Sometimes it is an issue with chewing or moving food around. So we've had kids who pocket food, and we've had the OTs and speech therapists work with them on pushing that food out of their tongue, using their tongue to move food around from one side to the other. We have kids who don't necessarily know how to chew with their back teeth and only chew with their front. And the back teeth are the muscle of the mouth. That's really what's going to get food to go down and to kind of get smaller. So if we're having chewing issues, your kids will limit those food items. I'm not going to eat meat because it's really hard to get down and I spend too long chewing it. So I don't want that. Even looking at kids who have food that falls out of their mouth often, at a certain age, we shouldn't see that as much. Excessive drooling for kids who are past that 18-month range, we shouldn't really have excessive drooling. Signs of those typically mean your child hasn't developed the oral motor muscles. So they're not able to hold food in, or sometimes they'll drink something out of a straw and it'll just kind of slip out and you're like, what? We make that joke, like, do you have a hole? So looking at that piece, you're going to want to seek out support from either an OT or speech because they are familiar with some of those oral muscles and working on the chewing and the swallowing and building those muscles in there. The other piece is sensory. So especially within the autism community, we have a lot of children who have sensory aversions. So they may see a certain food type, and because of the texture, the smell, the color, the way it looks, they are just not even going to touch that item. And getting a kid to touch and explore food is half the battle. We'll talk about that. We kind of dip into this area and we have some strategies that are simple enough for parents to do at home. But if your kid has excessive sensory, then you're going to want to work with that OT again. You're going to want to seek her support out in presenting and working your kid into tolerating some of that sensory. And the last one is conditioned aversion. So conditioned aversion is if your child had an allergic reaction or a situation where maybe we even forced them to eat broccoli once. If we forced them, we have conditioned them to not like broccoli, even though maybe they would have liked it. That situation of us putting them in it and forcing them to eat it will cause them to never want to eat broccoli again. Another example of conditioned aversion, a kid who drank eggnog too much on the holidays, really loved eggnog, but he drank too much and then it made him throw up. And so now he never ever wants to drink eggnog again. We've conditioned him to not like eggnog anymore. So you would have to go and slowly present it again and say, well, let's try it. It's not bad. And we would have to take some steps to kind of uncondition that aversion. But you'll have situations like that where your kid had a bad experience with that food and never wants to look at it or see it on his plate ever again. So once we've looked at that piece and we've said, okay, well, there's no medical issues, but maybe, or if there is a medical issue, you went to your doctor, they're working that out, you're working with OT. Now, from a behavior standpoint, what are some other reasons why your kid becomes a picky eater? So some of them can include routines. Routines can either hinder or benefit your child. It's kind of like that's a good thing, but it's a bad thing. So when we talk about routine, we talk about feeding time, places, and foods. Some of our kids get very routine with how they want to eat their food, where they want to eat their food, and who feeds them even. Oftentimes as parents, because we don't want to starve our kids, you are providing those preferred food items. So it's always eggs in the morning because that's what he eats and I know he'll eat it. So it's become routine. And especially with our kids on the spectrum, they enjoy that routine. And when that routine is changed, it's very hard for them to understand and tolerate it. So that routine is kind of working against us. And we'll talk about ways that we can use the routine to benefit us. The other piece is kids are routinely allowed to graze. So we leave out snacks all day and they know that those snacks are available. So even if you provide them with here's some cucumbers. Maybe you want to try it. He's not going to try it because you left out Cheerios all day, or fruit snacks, or goldfish, whatever it is that he's snacking on throughout the day. They even have these routines that they get into with that stimuli, so the cups that they use. We have so many kids who parents are like, I want to get rid of this cup, I want to get rid of the bottle, but he won't let me. Every other cup I give him, he throws at me. He will not take another cup. It can happen. You can switch cups. We're going to talk about some ways that you can slowly progress your kid into trying a new cup. But you'll have those situations where they are stuck in that routine of using this cup. The other piece is, does your schedule allow your child to become hungry? So talking about that grazing piece, and Rebecca's going to get into it more, we have to build motivation to eat. And if my kid's eating all day, mealtime is not going to be the time when he wants to be adventurous and try to eat new things. Even considering a visual schedule. So we're going to talk about visual schedules with you guys, but allowing your kid to see when food is going to be available, when we're going to eat next, is important, because I think for some of our grazers, it's, and you moms are great. You guys carry around bags, and in your bags you have all the snacks ready for him. But sometimes we're kind of working against ourselves by having all those snacks readily available. So we'll talk about that. Opportunities. So when we work with families, there's a lot of different cultural and family considerations. I will tell you, I grew up in a home where my mom did not eat a lot of vegetables, and she did not provide us with a lot of vegetables. It wasn't until my sister was dating a Vietnamese man, and we started going to more different restaurants, and we started eating different cultural foods, that I was like, I really like vegetables, and I want to add this to my food repertoire. But before, it wasn't really a staple in my household growing up. So thinking about those cultural family considerations, what are you providing to your child? Even though it's not something that you would normally eat, they might eat it. As a parent, am I a picky eater? And do I provide those foods? So as a parent, sometimes we think, well, I don't really like green beans, and I don't think he would like green beans. But you'd be surprised. Kids' taste buds may differ from yours. So just because you don't like it doesn't mean that you should assume, and you shouldn't provide that opportunity. Choices provided. So even when we think of choices provided, we start to limit. I don't want to waste this food. I don't want to spend money on food he's not going to eat. So I'm only going to provide what he likes, because that's what he's going to eat. But as a parent with picky eaters, we notice that that just kind of starts to limit them even more. And so your kid who had 10 starts to work down to 5, because we're always providing those same foods. And at some point, he's going to get sick of chicken nuggets. And so we're going to start to slowly decrease that amount of food that he's actually eating, or the choices that he has. The cost of food is also, like I said, spending money to buy extra food, or even considering that vegetables and healthier foods are not necessarily the cheapest. It's a lot cheaper to go to McDonald's and do those dollar menu things. But again, it's not really providing your child with nutrients, with a wide variety. And then the fear of wasting food, I think, is always a parent concern. Reinforcement. So part of your environment that you set up with your child, you've probably reinforced some of these eating behaviors. That doesn't mean you're a bad parent. Everybody's done it. We've all been in the position, but I want you to start recognizing and realizing some of those times when you reinforced. And when I mean reinforced, it means you gave it attention. You gave in, and so your child knows, if I scream loud enough, if I throw my food, if I don't eat it, then mom will take that plate away, right? So this is a lot of behavior jargon, but basically what it means is, if your child engaged in a negative behavior during mealtime, if they cried, they screamed, they threw items, you as a parent probably remove that item. You're like, okay, I'm going to take broccoli off your plate. Okay, I'm going to take the green beans off of there, right? Or you as a parent probably provided something better. Well, okay, you won't eat this. Let me give you your favorite bread. Let me give you the fruit snacks. Let me give you goldfish, because you just want to make sure they eat. Or you provided them attention. Please, please sit down and eat. Mommy will do anything. Mommy will give you dessert after. Please just sit down, right? And we sit there and we beg and we bargain with our kids. I want to make sure that we're considering that this is going to have your kid do these behaviors more often. So in the long run, what happens is he realizes, I threw food, mom gave me different food and food that I like. And so anytime I don't want something on my plate, I'm gonna throw it and I'm gonna get something good. It's not necessarily, like I said, not a lot of parents notice it and can see it, but from a behavior standpoint, that's how we see it. And that's how that behavior continues to grow and get worse. And then now we have this terrible monster during mealtime, and we're like, what happened? The other issue that we often see is supplemental drinks. So you go to your doctor, you say, I'm very concerned, he's not eating enough, he's not getting enough. And sometimes your kids are in that bracket where they are not receiving enough nutrients. They are a little bit under their weight or under their height. And your doctor says, well, let's try Pediasure. Let's add in some Pediasure. Or you as a mom are like, okay, they've got some good things in here. Let's try Pediasure. I want to caution parents against Pediasure. I'm not saying never use it. I'm not saying don't listen to your doctor. I'm saying just be careful when you're using Pediasure. There's a lot of things that they don't talk about with Pediasure, and we see it. So one of the things is that it's really high in sugar content and calorie content. So typically they give these to, babies who are premature because we want to kind of fatten them up and get them to where they should be. Makes sense. They really need it, right? But at some point we have to get off of Pediasure. Problem is that some kids don't get off of Pediasure. They get stuck in the routine of drinking Pediasure. And so they want it almost like a bottle before bedtime or in the morning. I drink my Pediasure. I'm not going to eat eggs or try any type of breakfast. Pediasure, right? It's a short term, so it's not long term. So if you have a picky eater, Pediasure will give some of those nutrients, but it's not a long term option. You don't want your kid at 12 still drinking Pediasure, right? But we do see some instances that this is still happening long term. It becomes a meal replacement. So because it's high in calorie, high in sugar content, even the high in fiber and protein, it is filling and it fills the kids up. So it replaces meals. So we don't get the opportunity to try new textures. We don't get the opportunity to try new foods. The other piece is constipation. So for kids that are drinking 1 to 2 Pediasures a day, it's really high in fiber. So we do see a lot of constipation and even bloating. So again, not necessarily a good option long term. And then the last piece is oral motor. It's a shake. It's something they drink. We're not practicing chewing. We're not practicing moving food around. So a lot of our kids, especially kids with autism, will get stuck on Pediasure. And once we're stuck on Pediasure, not only do we have to work on food exposure, but we also have to work on getting rid of the Pediasure, getting rid of that routine, getting rid of that meal replacement. So I want to caution parents against Pediasure. I'm not saying don't use it. I'm not saying don't listen to your doctor. I'm just saying use it, but be mindful of how often we're using it. Be mindful of what's in Pediasure and how long you plan to use it to provide that supplement. It only goes so far. The other piece that you want to consider environmentally and something that we could help with is the sensory. So again, we talked a little bit about the sensory. When you think about sensory, because not everybody knows what sensory means, you want to think about your 5 senses. It's basically how you take in your environment, how you process what's going on around you. So during mealtime, we present these foods, and sometimes our kids are so bothered by the color or the look of it, right? Sometimes you'll get a food even as an adult and you're like, oh, this doesn't really look good. Like the presentation of it doesn't look great, but it tastes amazing. You try it anyways and it tastes amazing. So you're like, great. So think about that piece, that presentation matters to our kids. We have some kids who will eat only certain colors of foods. They won't eat any green foods. It doesn't have to do with the fact that it's a vegetable. It's just because it's green. We can do simple, silly modifications. We used to do food coloring when I was a kid. My older sister got a science kit and she would make green pancakes. And they looked funny, but it was also kind of fun to play around with and to eat a green pancake. And that would be something that you could do to introduce a new food to a kid, change the color, make it different, right? Then we have textures. So some kids just are not touching certain textures. They don't like spaghetti because it gets on their hands and it's too sticky. They don't like applesauces because it's too wet. So certain textures they will see and they will avoid at all costs. They won't want to touch it. They won't want it on their plate. So even just exposing your kid to certain textures, and Rebecca's going to talk about ways we can do that. Some smells and odors. So certain foods don't smell the best. That was something that I learned as I started to venture out into other cultured foods. They sometimes have really stinky cheeses or really different flavored foods that don't always smell good. But when I taste it, it's great. But it takes a little bit to get past that smell, right? Then you have flavors. We have kids who only eat really bland food, really unflavored, dry white rice. nothing with that flavor. But then we also have kids who want really flavorful food. So I met a 2-year-old once who would eat those hot Cheetos and Takis really spicy. And I just thought, I can barely eat those. How is he eating those? And obviously, it's not good long term for him to be eating a bag of those chips a day. So we had to work on it. But he really liked a lot of food with flavors. So we had to kind of venture in that area for him and help him find highly flavored foods, but that were better for him long term. Even the sounds of food. So certain kids don't like that certain foods are really crunchy and really loud when they eat them, or they don't like foods that are mushy and it sounds mushy when you pick it up or when you bite into it. That's definitely something you want to consider. So sometimes when you're watching your kid and you're looking at the foods that they eat, look at what's the same, what's different. What is it that they like about this food item? Because that'll give you a clue into some of their sensory needs. You might even get clues about their sensory needs throughout their daily living. Like he's not a kid who touches Play-Doh or slime. And so he's also not a kid who eats pudding or Jello. It's not going to happen, right? Knowing those things will help you see, okay, these are things he's afraid of, and I could do some exposure. We could figure out some ways to play with it and to get him to maybe get some interest in it. Other things to consider, so where are we eating? Some kids, if we have forced them to sit in a high chair, we have forced them to eat in the high chair, have developed a negative and conditioned aversion to high chair. High chair means eating, high chair means I'm gonna cry, it's bad, I don't wanna do it. We all have this aversion that we've developed with the dentist. Dentist means bad. He's going to look at my mouth. He's going to have this loud drill. Don't want to do it. Even though sometimes we go to the dentist and it's fine, it's great, it's easy. You have developed that. So sometimes consider seating. If the high chair is not your best option, if you notice even just putting your kid in a high chair to do paint or to do something fun is a battle, then maybe we just change up seating. Maybe we use a table with a booster. Um, Sometimes the kitchen's been negatively paired. So going in the kitchen and eating in that area is something that he already knows is bad and he doesn't want to do it. We've built that distrust. He's used to us trying to shove food down his mouth and he's like, nope, I don't want anything to do with it. The idea of family dining versus solo eating. So a lot of families who don't have a schedule or routine, which again with COVID has become really common, we are working from home, our schedules are different, and so eating at the dinner with a family isn't always priority, but I'm going to tell you that it's something that will definitely help. Kids who eat by themselves, we're missing the social piece. We don't get to do certain activities with them. We don't get to reinforce and say, good job, you took a bite. And so eating with your kid is important. And then looking at those utensils. So is my kid not eating with certain utensils? Is certain utensils and plates important to him? Because if that's a simple modification that you're willing to make, like, yes, you can eat from that Mickey plate and we'll just keep it clean, then I would rather do that than have such a picky eater, than have a kid who refuses to sit down and eat. So certain modifications as a family you'll want to make, and then we can work on working away from the Mickey plate. And well, we can use Mickey plate for dinner, but not for breakfast and lunch. So you'll make certain adjustments to get him to where he needs to be. But long term, what does it hurt for you to make this simple little adjustment? So Rebecca's going to talk about some of the antecedent strategies that you can consider using with your child, and then we'll go into kind of how to package them together at some point because there's a lot.
Okay. So antecedent strategies are basically just strategies that we use to set up like a successful plan. So we put these strategies in to help make sure that this behavior occurs and help it make it more likely to succeed. So some things that we want to consider prior to implementing the plan is tackling some of these things with your kiddo. So if your child has some aggressive behaviors, right, we have to tackle their aggressive behaviors and get them to reduce those behaviors to even implement the plan. So if you have a kiddo who doesn't even want to sit or doesn't want to go into the kitchen because it's a negative experience for them, we have to slowly expand that tolerance and reduce those behaviors. Knowing what type of reinforcers we can use, we'll go over that under consequence strategies. But reinforcers are good to have to motivate them to sit and try to eat those new foods. Preference list, knowing what type of foods they do like, so we compare some of those foods with newer foods that they don't like. Sitting is half the battle. If they don't want to sit, to eat, it's a big thing, right? So like Teressa mentioned, like we can just work on sitting and pairing it as a positive experience with some of those activities they do like. The utensil usage. So if at some point we've tried to shove food down their throat or their mouth, and it's become a negative experience for them, they might be resistant to even trying different foods with that utensil. So we might have to reduce our goal for that and just work on them tolerating the utensil being brought to their mouth without them trying to fight us. And then the last one is feeding the feeder. So who's part of this plan? Who's involved? So knowing who's going to implement is important for that consistency. So then the child doesn't only pair feeding time with mom versus dad. Everyone's in part of this plan and implementing it so it's continuous across the family. Another good strategy is making it fun. Sorry. So thinking about ways to entice it and make it motivating. So being silly, using some characters. Teressa has her niece that they sing Baby Shark and they do like a chomp 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 and they pretend to all eat broccoli. I use like apples and bananas song with my nephew to get him to try different foods, using those little sounds about the airplane, right, to get them to be motivated to try it. Using characters, so those character plays. Blippi is the phase right now. That's all I hear about. So if there's a Blippi plate out there, and that's going to motivate your child to want to eat because they want to see Blippi at the bottom of their plate, we can try that. It's fun. It's exciting for them. They're motivated. It's a great way to do it naturally. And it makes it a positive experience. Presenting food in different manners, like Teressa mentioned, those green pancakes, making silly faces on there, different shapes on with their food. It's all really fun. It's very natural, and it creates a motivating and positive experience for them. The next one is scheduled meals. Sorry, it's so how Teresa talked about, it's a good and a bad thing to have a routine, but for mealtime, we want to make a routine so that kids learn to understand those hunger cues. So the way that we could do this is to make it part of a routine, right? And here's your little visual schedule here that we can implement with kids to get them to understand what exactly is mealtime. Maybe we start with hand washing, then we choose our foods, or we serve and we sit down together. So creating a routine is important, and maintaining that consistency, like we eat around 9 a.m. all the time, helps establish those hunger cues. And so at some point, like, oh, it's almost lunchtime because my stomach is growling. So ways that we can work on this routine is eliminating the grazing. The grazing really reduces those hunger cues because kids get offered food throughout the day and there's no like limit as to what they're eating, which in turn doesn't help with that picky eating. So it reduces the exposure of other foods. So we want to try doing the family meals to make it more of a routine and social experience for them, because they can see that everyone's eating with them and that's not just them. And then also reducing the types of alternative meals. So we can still offer some of those meals that they do like, but putting on the same plate with those meals that you make for your whole family. So if you're making chicken, rice, and broccoli, and the child likes chicken, and normally you just give them chicken and not the broccoli and rice because they normally don't eat it, you still want to present it. You can still give them more of the chicken, but still add in your rice and your broccoli so that they know that it's on their plate. They learn to tolerate it on there, and they see that everyone else is eating it. Also using a timer. So ideally, the mealtime for children should be between 20 to 30 minutes, because anything past that becomes like an aversive experience, right? You don't want to make it a negative thing for them if they have to sit there until they eat their whole meal. So using a timer lets them know that there's an end to this, so they're more likely to eat within that time frame, because they know at some point they get to go get down or go move on to something else. Okay, the next strategy we have is modeling. Modeling is super fun. It's easy. It's something that we do naturally. We show kids what to do. It's great for kiddos who do imitate, who like, you know, clapping and stomping and looking at what you're doing and trying it themselves. So it's very fun. What we want to consider is peer model versus adult model. So sometimes kids respond better to their siblings if they try it. I have a kiddo who does this. Mom will show him a food and she's eating it and she's making it super fun. But he's like, no, not gonna try it. But then sister will just sit there and she'll eat it and he'll come up and ask for that food. So sometimes it's just that, just changing who's modeling will be important. It's more motivating if they see their siblings. Enthusiastic modeling, making it really fun, saying this is yummy, oh, delicious, making it enticing will make them more likely to want to try it. And then also modeling what's expected when they don't like it. So for the most part, most kids, when they don't like something, they spit it out or they throw it or they chuck the plate across the room. But that's not really appropriate, right? We want them to learn how to say no without those behaviors. So you can model, oh, like, okay, I'm going to put this to the side. I didn't like this one. No, thank you. Or shaking their head no and just moving it to the side versus throwing it. The next strategy we have is stimulus fading. So this is working more on taking smaller steps to alter like the item or the liquid or the food so that they tolerate it a little bit more. So the biggest thing I think we run into is the juice thing, and the juice becomes more reinforcing and then kids don't want to drink water. So what do? We slowly dilute the juice, right? We do maybe 75% juice and then 25% water. And then they get used to that. And then you change it, right? You add 50% juice and 50% water. And then they get used to that. And then eventually they're drinking just water. But it takes some steps, right? It's not overnight. It takes some slow exposure to this. And over time, they are able to do it. So that's really what stimulus fading is. It's just taking the steps to change the stimuli over time. So like how Teressa mentioned, some kids only want a specific cup and it has to be the blue cup with Spider-Man on it. And that's the only cup they'll drink out of. So we just try to modify it. Okay, well, you can have your Spider-Man cup, but he's going to be in a red cup instead of the blue. Or we're not going to put the lid on today. We're just going to leave it open. So at least they're learning to tolerate the visual look of it and still drink the same liquid. Smaller bites is a good one. So starting with small bites of chicken and slowly increasing in the size of the chicken or the amount of it so that they're tolerating it. And then liquids to solids as well. So kids who only like pureed and soft and creamy foods, and then they get those chunkier foods, it's hard. So we slowly change it. So we add in, we still keep it creamy, but maybe there's some chunks in there that they're normally not used to, and we just add it in there and increase the chunkiness over time. Food similar in color is a great way to do the stimulus fading. So if a kid likes green apples, we can put green grapes or green cucumbers on there. They're all green, but he still gets that food that he likes in there. And then come to the cup to spoon. So like we mentioned, some kids are averse to just the utensil, so we can try modifying that as well. So if the kid does not want to try the spoon, we can start with measuring cups. Measuring cups are still, in a sense, a spoon, but they're bigger, right? So we get them to eat with the measuring cup and then slowly reduce the size of the measuring cup to be teaspoons and tablespoons, and then eventually the normal silver or toddler spoon. And then for the stimulus fading, I just want to make a note that this is not tricking your kid. So we don't want to trick our kids. The food is still displayed there, but we're not trying to cover it up. So that's a big part. Like if we try to add in broccoli under mashed potatoes and then we put it in their mouth and then they taste that the broccoli and spit it out, we're losing that trust with our child. So making sure that we're still keeping the foods that they do like in there, but without and modifying it over time, but not changing it completely or trying to hide in other foods in there. The next one is pairing and presentation. So This one's good to start pairing some of those preferred foods with something that they're not normally used to or something they don't like. So it could be on the same plate or the same spoon. So you could put some rice in the beginning of the spoon and maybe a little piece of the broccoli after the rice so they see it. And if it eventually it becomes paired. So every time we deliver rice, we always put broccoli. And they don't have to eat it. It's just paired. They see it in their rice with broccoli, rice with broccoli. You always want to put your preferred food. That should be a large amount. And then your non-preferred is just a little bit. So it doesn't look as such a big amount and almost like a negative experience for them. Just keeping it small and slowly increasing over time as well. Like we said, don't trick the child. We're not making them eat it. We're not trying to mix it within the rice. It's next to the rice, but they don't have to eat it. We're just pairing it as a positive experience for them. Sometimes it does result in some negative pairing, like if a child sees it over time and doesn't, like just completely does not want to eat broccoli and now they don't want to eat rice. That's okay. We can go back and try again later, or a couple of weeks later, we can still try it. The big part is just continuing to expose the child to these foods so that it's not one and done, because at some point, sometimes our taste buds changed, even for me, right? Or for us, like I didn't like sushi. And at some point I started liking it, but it was exposure. So, and the pairing process of it. Our next strategy is behavior momentum. So this one's really fun. It's almost like a snowball effect. I think about like 3 easy tasks and then 1 hard one. So the hard one is always your food, right? The foods that they don't like to eat. So this is a great little graph that Teressa made. So you take a bite of your favorite food. So that's your easy task. It's fries. And you reinforce that. You say, great job, you did it. That was a good bite. Take another bite. And you reinforce that as well. Good eating, you're doing so great. And then another bite, woohoo, awesome. And then after that 3rd bite, you've built up this momentum right here. And then you add in, okay, take a bite of this new food. And it's a small bite. It doesn't have to be big. And then when you reinforce that really well, you're awesome, you did it. You get a sticker or you get this little card so that they feel successful. And they're more likely to try it because they've gotten 3 of those easy tasks in there and you've reinforced those. And it helps build compliance. You can start really easy. So maybe some kids don't want to eat them, like they don't want to spoon feed themselves. So you can say, okay, mommy feeds you 3 times. 1, 2, 3. Now your turn. So you built up that momentum. You can do it with spoons. Like if a child doesn't like to use a spoon at all, then we can say, okay, you just put the spoon to your mouth, right? 1 time, 2 time, and 3 time, reinforcing it. And then we dip some of the food into the liquid and see if they'll eat it. We can do it with it doesn't necessarily just have to be food. So we can do it with simple directions like touch your nose, touch your head, show me your tummy. Okay, take a bite. So it's very fun to do because it's almost like a game for them, but it builds momentum and they get the ball rolling. And then we add in that last hard task for them at the end. Okay, so the next one is providing control and choice. So kids like to be in control of their environment. It's definitely a hard thing to share that control. When we provide foods and take away the foods that they don't like to eat, we're taking away that control. So we have to give them some type of control so they feel like they're part of this routine, that they get some of those choices. So ways to do this is to provide 2 different options of foods, right? Did you want to have cucumbers or did you want to have peas? They get to make that choice. Plating, right? Do you want blippy plate? Do you want Mickey plate today? Okay, what about your utensil? Did you want a fork or do you want to use a spoon? Do you want the red spoon or the blue spoon? It really just helps them get some of that independent skills and be part of that routine, and helps them feel like they are in control of their environment. The seating as well, they get to choose where they sit or what chair they're going to sit at the table. And then even their type of reinforcers. What should we do after we finish eating? Do you want to do outside? Do you want to play Play-Doh? Do you want to do some video games? So those are all great reinforcers, and they get to make that choice. And then if you need to do like a forced choice, like where you only have 2 options, more so like for your snacks, right? When you're saying, oh, we can't have ice cream for her snack, but you can have apple or strawberries. Those are your choices. When we redirect that attention to that, they can make that choice. It's still forced. You're still only offering those two things, but they feel in control because you're providing those choices. Okay, the next one is Premac. So Premac is first this and that. I think we all use it kind of naturally. Like first you clean up toys, then you get tablet time. You finish rice, then you get to go outside. We want to pair this with a high preferred activity that they do like, but they have to work for it. So that's where you add in your low preferred task in there. So you take a bite and then you get down. So they have to complete that direction or that task that you ask them before they get access to the item that they want or that reinforcer. It should be delivered in a simple manner. So very simple, plain language, so it's not too confusing. So like first this, then that is perfect. We don't want to bribe kids, so not saying like eat okay, if you eat this cookie, I'm gonna give you, or if you eat this piece of chicken, or I'm gonna give you this, or just kind of keeping it like you want to make sure that the reinforcers after they do what they eat what they're supposed to or what you want them to do. And then this helps just reinforce completion and compliance, and it can start slow. You don't have to do like they have to eat the whole meal and then they get that specific item. You can start with baby steps. Okay, you take one bite and then you get this, and then slowly build that tolerance. Okay, so this one kind of goes over that sensory piece that Teressa talked about. So if a kid is not or is aversive to touching food or smelling it, we need to expose them. And the exposure piece is hard, so we start really small. So just doing small exposures in different manners. So it may not necessarily have to be done just at the table or during food time. We can do it during fun, normal day-to-day play. If a kid doesn't like pasta or doesn't like the touch of the squishiness of pasta, we'll just make it a little sensory activity. We can play with it. We can dye it different colors so it looks more fun and they learn to touch it, and then slowly go expose them to it during normal meal times. Jello is a good one too. Jello is sometimes a little bit funky for a lot of kids, and it jiggles, it's slimy, it feels weird if you squish it, it's funky. So making a little Jello treasure chest so they can find things in there and they learn to tolerate that texture without having to eat it. They're smelling it, they're using their senses. That all helps them learn to tolerate and eventually learn to taste it. So you can practice with different types of food. I have some kids who don't like dipping sauces, so we play with it. We put toys and we say, okay, they're dirty. Like we have to clean them. So we put ketchup all over their toys, and then they have to wash them. Just helps them touch it and smell it, and then move on to the next activity. So exposing your child to different textures and different ways is important. And then you can do what we call the touch, kiss, lick, bite, and eat trial. So they touch it, then we can work on putting it up to their mouth to kiss it, then show them that they can lick it or bite, and then eventually consume it all the way. Okay, so consequence strategies. So these strategies are what we put in when let's say, or to help support the behavior or reinforce the behavior after. So the first one is reinforcement. So similar to the potty training that we did, reinforcers are different for every kid. But we do it to reinforce those good behaviors to increase the likelihood that the kid will do it again the next time. It's just reinforcing the behavior over time. It helps build the motivation. So if a child knows they get to pick a favorite activity after they eat, they're more than likely going to want to try that food again the next day or follow through with that meal time the next day. There's a lot of reinforcement procedures, so we can definitely pair it, and we'll go over them more in detail in the next couple of slides. But these are your main types of reinforcements. You have edibles, so you can do chips, candy, cookies, an activity. using chase, painting, outside, ball play, some tangibles like small cars, small fidget toys, stickers, social, high fives, good jobs, clapping or saying, hooray, you did it, and sensory, spins, tickles, like big bear hugs, air throws. We definitely want to try to pair a lot. We want to pair all of these with the social praise so that they learn that social praise is something to be motivated by. Okay, so these are ways that we can work on reducing the reinforcement so it becomes more natural. This token economy is almost like a sticker chart because it helps the child visually see what they're working for, and they get to put their little sticker on there, their little square piece of their favorite character on there. So the visuals for help them see exactly what they're working for, and then reminds them like this is what I get after I finish this meal or these bites. They get to choose that reinforcer, so it increases that control part of things for them. And then you can start slow, so you can do maybe 2 bites or 2 spoonfuls, and then they get that reinforcer. Every child's different, so just discussing with your specialist or your intervention team where the child should start, or how many items or bites or a number of foods they should eat before they get that reinforcement, and then expanding over time and making it like they have to do more of the bites before getting the reward. Okay, so this one's pretty fun. I just actually recently found out about this one, but it's a mixture of token economy and behavior momentum. So it's like a little dinner play, and it's a little maze, and it has a lot of strategies in here because you have your reinforcement. They're learning how to eat new foods, and they have to eat a certain amount of foods before they get that reinforcer. So if you see here, you start off with the start area. So what you can do is put your 3 foods they do like first, and then on the keep it up area, you just put one small piece of something they normally don't eat, or they don't know what it is. And then that way they eat this one, and then you put just 3 foods they do like, and then one small piece of something they don't like, and then they get a big reinforcer. So it could be a piece of candy or some small toy in there, but it makes it fun because we're praising them along the way, and they're getting these keep it up, good jobs, and they're seeing their foods as well as new foods. So this is a great way to reinforce the behavior. Okay, so sometimes we still run into like those behaviors we don't want to see, which means that we have to put in some strategies to work on reducing these behaviors or placing it what we call an extinction. Like we no longer want to reinforce these behaviors. So ignoring behaviors we want to see less of, so crying, whining, maybe throwing the plates off. The planned ignoring is more so for when kids want attention for attention from you guys. So if a child is crying or looking at you and purposely throwing things, we're not responding to it, because then they learn that if we do respond to it, they get that attention that they do want. So we're not responding to the whining. We're not saying no, stop it, don't do that, because that gives attention more to that behavior. What we do want to do is, if it is like a self-interest behavior or they're throwing things, we just want to remove it and block it. We're still not providing eye contact so that they learn that this is not reinforcing. The minute that they're calm is when we provide that attention. So then that behavior is what they get that reinforcement for. And they learn, okay, me being calm gets most attention. So behaviors that we want to see, we will provide attention to, and those that we don't, we want to ignore and redirect. Sometimes even the attention that you give during that time, like when they are being bad, becomes a reinforcer for them. So kids think it's funny because maybe the first time they threw it and they looked and smiled and you said, no, don't do that. And then that tone of voice, they think that's silly. And so they'll do it again. And then it becomes a way to get attention. So this is where your planned ignoring strategy would be important. Just blocking it, not giving attention, and providing praise and reinforcement when they are eating and they're using their utensils, and getting your attention appropriately. Okay, and the last strategy is escape extinction. So this is when kids want to escape the the whole meal. We're just not providing that as a way of getting out of following through with what you ask. So it is challenging because some kids do have severe behaviors when this occurs. Like if we don't let them get out of the seat, then it triggers a lot of behaviors. So that's why we always say, let's really aim for like antecedent strategies first and fall back on these if needed. When we do the escape extinction, we don't want to strap kids into high chairs because that's not a typical way of, of escaping a task. So they're not even allowed to leave if they're strapped down. So we want to teach them how to escape the task appropriately or what they need to do before they're allowed to leave the table. And when we think about school, they're not strapped in, so they need to learn how to sit independently and communicate that they're done. So you can require one more bite. So let's say a child tries to leave and they maybe only had one bite. You can say you have to take one more bite before you get down. And then, or you can even let them know prior to delivering the food, you have to take 3 bites and then you're all done with food. So letting them know prior to them sitting down what's expected, so they're more likely to follow through. And then not allowing the child to throw or remove the food. So giving them different alternatives. So if a child doesn't like food, that's okay. We can try it later. Doesn't mean it's a bad thing, but teaching them, okay, you can leave it to the side, or here's a cup where you can put the food you don't like. It's an appropriate way to escape that task, right? And not necessarily going to a behavior. And then using the timer to signal end of meal. So this works for kids if, like I said, if they know there's a time limit to this meal and they move on to something else, it'll help them be more mindful of wanting to eat because, okay, we have an end to it. But sometimes that means that some kids are smart enough. They're smart enough to understand that the timer is the one that lets them get out of the meal time. So they won't eat the whole time. So when that occurs, we might have to provide different healthy choices as your next snack, or present that food again for dinner.
So as you're finishing and you're looking at some of those strategies, long-term, we want you to think about planning and generalization. So you have all these great strategies and some may work and some may not, but irregardless, you want to work on generalizing skills. So feeding should occur, with different people. You want him to have the same feeding habits he has with you or she has with you with grandparents, with older siblings or nannies. So regardless of who's presenting the food, it's going to be a matter of who's going to actually be, receptive, or who the kid's going to respond to. But ultimately, we want them to do the same strategies so that grandparents can feed the child and still have that success. Different items, different utensils, different seats. So thinking about the different items you have and then different settings. So feeding shouldn't be only great in the home, but also in the community when you guys go to restaurants, or if child is eating at a school or daycare setting. And then planning. So we presented all these strategies to you, and it's a lot. It's definitely a lot. And even when we're working with families, we mentioned we always rule out medical issues first. Sometimes it's something that's such a simple fix of, well, he's just allergic to those foods and his body can't tolerate it. So that's something you want to consider. If you're working with a team, so let's say you have ABA and speech and OT, it's always nice to have a collaborative approach, because if OT is working on the chewing, swallowing side of things, then we will work on the, behavior aspect of things. But being able to kind of communicate with them on what's working versus what we've tried already is important. You want to make decisions on your child's need and what their affect is and what you feel confident doing, because not all of these strategies work for all kids. Not all of them work for all families. So what's going to work best for you and your family is really dependent upon your needs and your schedule and what you're willing to do and what you're willing to try. Like Rebecca said, you always want to do antecedent first. The consequence strategies are typically more challenging because they require you to follow through. Whereas the antecedent strategies, you present changes in the environment, and as a result, it may just kind of affect their behavior. So if you don't know where to start, we gave you all these ideas, we gave you all these options. If you don't know where to start, the biggest thing that you can start on, and what most OTs recommend for parents who are like, I have a picky eater, before we even ask questions, before we even know what the root of the cause is, it's always just scheduled meals and liquid intake. So schedule meals so you can build hunger. and reduce some of that liquid intake. Not even just in terms of, like I said, the Pediasure, but even the juice intake in between meals will fill your kid up. So if you look at reducing that liquid intake or just working on water being the option in between meals, your kid will build that hunger cue and want to eat more during mealtime. So typically that's something that parents will change and adjust, and it'll correct a lot of stuff on its own. That's one of the most basic recommendations we can give all of our families. If you have questions or you want to know some of our resources, Broccoli Bootcamp was a book that we pulled a lot of resources from. It's a very simple to read book. I would say it's about 100 pages. It's not nothing too crazy, but it is parent friendly. So I think this one is a really good resource and option for our families. But we also kind of dove into the research to see what was going on and what were some other strategies that were effective on top of what we see in the field. If you have questions, you can either type them in the chat or you can unmute your mic now and kind of ask us. We do have some time to stick around to answer, but also our emails are here if you do want to email us with any questions. And thank you guys for coming. We really appreciate it. We hope you were able to take something away from today to kind of help or adjust your household and help your picky eaters.
Thank you guys so much for that great information. This is a great time to ask questions if anyone has any questions. We also have another webinar with Teressa and Rebecca next Wednesday at 1 o'clock. We'll be going over behavior. They've been great. They did a webinar on potty training last week, and then we have another one on communication in a couple weeks. So thank you all for coming. We'll be sending out the recording and the slides, if that's okay with you guys, shortly later today. And if there's no other questions, I think we're good to go. Thank you guys so much.
Thank you guys.
Thank you.